Good morning, everybody. We are always now hearing that it's India's decade, if not India's century. And by 27, we're going to be a $5 trillion economy. The demographic dividends are uniquely placed in our favor. Of course, we have the challenges of the diversity and the inequity of our country. But strategically, India is becoming geopolitically very important. And if you see that they're not going to be only USA as a power block, they're going to be multiple power blocks, and India is going to be another powerhouse. And so this is a big opportunity. And we really need to take up this opportunity because all these years we felt we could do more, but the only thing is the people could not afford. And so we were finding all means of compassionate capitalism and doing so many other things to try and balance out things and get to everybody to provide comprehensive eye care. But here's the opportunity. And if you say affordability, over our Dr. RDR was also telling us, uh, we see that the affordability is 1 month's per capita income is probably the cost which is comfortable for cataract surgery, and a 1 day per capita for OPD expenses of the particular place. And this, if it goes up, the our opportunities go up. And if you follow the uh, anti-VEGF story also, you will find that again this becomes the biggest segment, almost 50%. These are old statistics, but even now the whole things haven't quite changed. So again, if we say the diversity, I mean, West Bengal's GDP is half of Maharashtra's and one-fourth of Delhi's. So the affordabilities differ. Disha has to be an affordable and a low-cost hospital because we are located in West Bengal. So this is a map of the to show very interestingly how the per ticket cost of cataract surgery in Disha has changed over the GDP or the per capita in West Bengal. Now it is 20,000 in the year 2022, last year. So this is how we can actually have more people to afford quality eye care. But definitely it has to be equitable and be inclusive. And obviously, trying cost containment is a major strategy in this direction. I mean, some can afford to be costly and be elusive and exclusive, but this is, technology is the biggest enabler. Systems, delegations, processes, and the ability to scale up and propagate, and also using economies of scale are the things which we can imbibe in more efficiently as the economy improves. Often there is this connotation that low cost is probably low quality, but perhaps uh, yes, definitely quality is not is non negotiable. But if you remember that simply flying days, and if you say think of the most popular airline today, there is a very strategic difference. They were fairly priced. They did not compromise on operational efficiency, their aircrafts. I mean, they just said that what does the flyer want? A flyer wants to fly from one destination to the other without fuss and fuss. So let us give them that, and on time. So simple strategic things, and they bought 100 aircrafts when the Indian skies didn't have 100 aircrafts. Today they have a fleet of almost 300 aircrafts, and occupy more than 50% of the aviation market. So again, when we talk about patient experience, now it's about giving experiences to the patient rather than care or treatment. So the first question that comes to our mind is, can the patient, what does the patient want? Well, frankly, I would say that it's not a very good question to ask, because they want everything. They want the best time, the best consultant, the most suitable place, the best equipments, and everything. But a better question probably would be, what is the patient willing to pay for? Because in a growing economy, these are the orders which we have to pass through. So, if we ask this question and we get a proper answer, we are addressing the community needs in a more logical sense, and then carry this affordability to aspirations. Yes, obviously, at some point, eye care and healthcare has to get aspirational. So, cost is the first step in towards quality, and unless it is not affordable, it doesn't exist. But if we focus on quality, definitely the cost will improve, because one of the biggest aspects of quality is that it definitely improves costs, and simplification is ultimate sophistication. And we have to have very transparent records every transaction, go brick by brick, so that we don't have sleeping costs. Infrastructures can be on rent, equipment on hire purchases. Sleeping costs could be brought down. Appointments could make systems more efficient. Multitasking of staff, doctors on incentives rather than stocked up salary, and everybody in the organization to try justify their remuneration. When you focus on cost and cost efficiencies, and the organization is patient centric, and it is always tries to be on the patient side, and justifying the cost of services, that you may choose this lens, why are you paying so much more? So, like, kind of thing. And we even use optos as a indirect ophthalmoscopy, because we find the retina surgeon probably thinks he doesn't want to bend his back so much, rather is more interested in lasers or surgery. So it works, and we recover the costs. So, having said that, we also use laminar flow theaters for everything, because it is the environment which creates the discipline of the theater. And uh, I'll skip these slides. I think Partho asked another basic question, why he put this beyond affordable eye care. So, one is eye care. So, he probably asked Disha, what is the next thing? We are actually diversifying into multi speciality care. So, we have taken up a 3 acre uh, plot, and the construction is on. Hopefully, by September next year, we will be having a 5 lakh square feet, 600 bedded hospital. And the reason is because we had surplus, and so what to do with it? When we asked our staff, I asked our doctors, and more importantly our patients, they said, okay, I mean, you give us good eye care, but what happens to my knee, what happens to my husband's kidney problem, and why don't you do something around that? And so we have our old doctor friends who can actually help us out on this multi-speciality enterprise. And eye care is more competitive, and I think lot needs to be done in the general space. Branding is automatic, we are a pan Bengal brand. So, and our own 18 hospitals can act, as satellite centers. So, beyond affordable eye care, I think that's our next step. Thank you very much.
Thank you, Dr. Debashish. It was great comparing the increase in the volume of surgery with the increase in the per capita income. And thank you so much for sharing your thought processes on how to build up the